In need, let's discuss the iBudget system, which determines how services are funded and allocated. This section will explain the waiver system and the challenges families face in accessing critical supports. So, what is the iBudget waiver? The iBudget waiver is Florida's Medicaid-funded home and community-based services, HCBS program, that provides individuals with developmental disabilities the supports they need to live in their communities rather than institutions. To understand the iBudget waiver, we need to distinguish between 1. Medicare, a federal program for seniors and some disabled individuals regardless of income. 2. Medicaid, a needs-based health insurance program covering medical costs for eligible low-income individuals. 3. HCBS waiver iBudget, a Medicaid program that allows individuals with DD to receive services in their communities rather than institutions. Unlike Medicaid, the HCBS waiver is not an entitlement. It has a long wait list and limited funding. To qualify for the iBudget waiver, an individual must be a Florida resident, have a qualifying developmental disability, demonstrate the need for long-term support to avoid institutionalization. Even if an individual meets these criteria, due to limited funding, they may be placed on a wait list rather than receiving services immediately. The iBudget waiver is not an entitlement program. Florida uses a priority category system to determine who receives services when funding becomes available. With over 21,500 individuals on the wait list, families often wait years for assistance. Addressing funding limitations and expanding service capacity is essential to reducing these long delays and ensuring that individuals receive the support they need in a timely manner. Not everyone qualifies for services immediately. Instead, applicants are sorted into 7 priority categories based on the urgency of their needs. Priority placement determines how quickly an individual receives services when funding becomes available. For many families, the wait can last 5, 10, or even 15 years, leading to significant hardship and potential crises. Individuals placed in Category 1 are facing an immediate crisis, such as homelessness, risk of serious abuse or neglect, the sudden loss of a caregiver. In 2024, Senate Bill 1758 reduced crisis eligibility determinations from 45 days to 15 days. However, implementation remains challenging, and delays still impact many families in need. Please click to see Gabby's story to further understand. Addressing these delays is critical to ensuring that individuals in crisis receive immediate support. Young adults transitioning out of the child welfare system often require additional supports to prevent homelessness and regression. Without access to waiver services, many are left without proper housing, employment support, or independent living skills, leading to instability and long-term challenges. Investing in early intervention and smooth transitions is essential to ensuring these individuals do not fall through the cracks. Individuals with severe functional limitations who require substantial support but are not in immediate crisis fall into Category 3. These individuals may require 24-hour supervision, complex medical care, behavioral support services. While they are not in a current emergency, lack of services could quickly lead to crisis situations without proper intervention. Individuals in Category 4 have primary caregivers who are 60 years or older, making them at risk for losing their support system as their caregivers age. Without proactive planning and access to services, many individuals in this category face institutionalization or emergency placement when their caregiver can no longer provide for them. Providing long-term support plans and expanding respite care options is essential for these families. Young adults transitioning from school-based services to adult programs often face a gap in services when they turn 22. Without continued supports, such as employment training, independent living skills, and personal assistance, many individuals struggle with regression, isolation, or financial dependence on family members, Ensuring smooth transitions and early enrollment into adult programs is key to long-term independence for these individuals. Category 6 includes individuals over age 21 who require waiver services but do not meet the criteria for more urgent categories. These individuals may still require support for daily living activities, employment assistance, residential care. Without these services, many adults with disabilities experience reduced quality of life and barriers to independence. Category 7 includes individuals under 21 who require services but do not meet the criteria for higher priority categories. This category includes children with disabilities who do not yet qualify for crisis intervention, young individuals who need support but have family caregivers in stable situations. While these individuals may not have immediate needs, ensuring early intervention services and long-term planning can help prevent future crises and reduce reliance on emergency supports. To reinforce what we've covered, let's test our knowledge. How many days does it take to determine crisis eligibility? The correct answer is 15 days. Thanks to recent legislative efforts, crisis determinations were reduced from 45 days to 15 days. However, implementation remains a challenge, and many families still experience delays in getting approved services.